Welcome to Brillians training video. Brillians is the new name for the application previously known as SupraVISTA. Today's topic is an introduction to cognitive support in Brillians. CPRS is an electronic health record system. However, it is not a cognitive support system like Brillians. The EHR and the CSS systems have different goals. They complement each other. CPRS is an excellent EHR system, one of the very best out there. Nothing in Brillians trainings should be taken to imply otherwise. So, what is the problem? Did CPRS ever tell you? Stop. Look here. There is a problem. No, because it does not have the intelligence to do so. Did CPRS ever ask you? Looking for all the relevant data on CHF? Here is everything you want to know. No, because it does not know how to do that. Did CPRS ever offer you? Searching for colonoscopy and EGD? Here is every instance I found in the medical record. No, because it is not programmed to do that. Did CPRS ever help with routine tasks? Want to write that letter or progress note? Let me do it for you. No, that is not my job. Well, you get the picture. A good cognitive support tool like Brillians can change that. Electronic health record systems like CPRS are designed to store and display data, not to analyze it. Most EHR systems have virtually no clinical intelligence and no actionable information to help make decisions. So, clinicians do the intellectual work of analyzing raw data to create actionable information. The net result is that the clinicians spend more time on computer care and less time on patient care. How about impact of electronic health record systems on patient care? An American Medical Association study in 2016, using data from a variety of clinical settings and practices, found that 50% of the physician time is devoted to keyboarding. Only 1/3 of their time is free to interact with patients. Physicians also spent 2 hours each evening on the keyboard finishing the data entry. In clinical settings, cognitive support provides the rare opportunity to positively impact 50% of the clinician time. So, what is impact on patient safety? Currently, clinicians depend on manual data analysis to identify issues of clinical concern. This process is time-consuming, cumbersome, and error-prone. A typical clinic visit does not allow sufficient time for adequate chart review. So, it is easy to miss an important clinical finding, which may result in patient harm. Therefore, in absence of automated data analysis, there is high risk of clinical errors. Think about this real case. On Monday, a basically healthy male patient in mid-40s goes to emergency room for gastroenteritis. He is found to have very low serum potassium, and is advised hospitalization. The patient refuses admission, and leaves against medical advice. On Thursday, the patient returns to the same emergency room with complaint of ankle sprain and requests a work excuse for the next day. The ankle exam and X-ray are negative. The EHR system did not warn about low level of potassium. Sunday, the patient dies of sudden cardiac arrest, likely from low potassium. Think about this real case. A middle-aged male patient is on warfarin for atrial fibrillation. In February, the patient is seen in orthopedic clinic and prescribed Motrin, which increases the risk of gastric bleeding. Over next 10 months, the patient is regularly seen in primary care, anticoagulation, and orthopedic clinics. His anemia is gradually getting worse. The progressive anemia is not documented or addressed. In December, the patient dies of massive upper GI bleeding. How did we miss progressive anemia despite multiple clinic visits over 10 months? It is easy to blame the providers, but what is the real problem? CPRS never says, "Stop. Look here. There is a problem you should be aware of." A typical clinic visit lasts 20 to 30 minutes. During this time, the clinician may have to complete 10 or more steps. Thus, the total time to complete each step is 3 to 5 minutes. An effective chart review requires well over 90 minutes. Frequently, the clinical errors occur if the provider does not see that a problem exists.
So, how does cognitive support help?
The automated data analysis identifies common clinical issues that may need further evaluation. Brillians provides a lot of additional information for each clinical issue. The clinician can easily review all the relevant information about the concerned disease, or the body system. You can search the medical record across all the data domains, which is not possible with CPRS. The clinician can download and search the remote data. There are many more tools to expedite common clinical tasks.
How about speed and efficiency?
In about 15 seconds, and with near zero effort, Brillians loads data and performs data analysis that will take over 2 hours, if it is done manually. Brillians shows a list of clinical issues that need clinicians' attention. A click on a listed issue provides a lot of additional information to help the clinician make a decision. A double click on a listed issue provides relevant view of the related disease, or the body system.
What clinical tools does Brillians have to improve clinician efficiency?
Clinicians perform many clinical tasks which can be automated. Thus, clinicians produce a better product with less effort, and in less time. Here is a partial list of tools in Brillians. Disease and body system-oriented views of data. Extensive search tools including Google-like keyword search of the medical record. Letter writer, progress note writer, RX writer, medical calculators, etc. And there are many more tools.
How much manual effort does it take to get all the benefits described in this presentation?
Nearly zero. Once the user is logged in, Brillians automatically synchronizes patient with CPRS. Patient's clinical data is loaded in the background, while the user continues to work in CPRS. There are no changes to the clinician's workflow. Most tools require no more than a few clicks to display the results.
How about a real-life use case, something clinicians need frequently?
Okay, let us talk about evaluation of anemia, which is a common medical condition. To manually look up all the data shown in the left pane, it will take about 10 to 12 minutes, 66 clicks, 60 keystrokes, and 40 mouse scroll actions. Brillians displays all the relevant data on one page, immediately. It takes 2 clicks and 1 second. That is a huge time saving. Here is another use case. The clinicians frequently search for reports to make clinical decisions. To manually look up all the data shown in the left pane, it will take about 10 to 12 minutes, navigation to different tabs in CPRS, and the user will have to manually find and read the progress notes, consults, procedures, and imaging reports, etc. In contrast, Brillians can quickly searches various sections of the clinical data and displays all the relevant information on one page. It only takes a few keystrokes and 1 second. That is a huge time saving. As a cognitive support application, Brillians is a systematic approach to reduce clinical errors and increase clinician efficiency. Clinicians have too much data to deal with, and too many tasks to complete in a short period of time. This leaves too little time for critical decision-making. Brillians automates data analysis and provides focused views of data. It provides many ways to efficiently search the clinical data. Brillians also automates many time-consuming, common tasks. The end result is that Brillians frees up the clinicians to focus on the intellectual work, rather than spend time on scut work. In summary, complex, intellectual tasks require cognitive support. This is plain common sense. Therefore, it is worth spending time on exploring and learning Brillians's numerous features. Why spend 5 minutes on a task if you can do it in 2 seconds? Thank you for taking time to review this presentation. We have many informative presentations on YouTube. Please search YouTube for Brillians Training, or SupraVISTA Medical DSS. If you have any questions, please contact us at help.supravista@gmail.com.